Hello and welcome to Physician Spotlight. I am your host, Dr. Vikram Christian. Physician Spotlight is a forum for us to learn more about our rising stars and leaders in the field of nutrition. We are very grateful to Aspen and our viewers for making this possible. On today's episode, I have Dr. Lindsey Russell, who is an associate staff and gastroenterologist at the Department of Gastroenterology, Hepatology, and Nutrition at the Digestive Diseases and Surgery Institute at the Cleveland Clinic. Welcome, Lindsey.
Thank you so much for this opportunity. And it's nice to be on this side of the interview for once.
Excellent. So Lindsey, it sounds like you recently joined the Cleveland Clinic at your current position. Tell us a little bit more about what you do there, what your practice looks like.
Oh, that's great. Well, thank you. So I just recently started here at the Cleveland Clinic, and it's interesting. I did a lot of training in Hamilton, which is on the other side of Lake Erie. So it's kind of very close to home at a very different place. It's interesting moving to a different country as well. But my practice here at Cleveland Clinic, I really have the opportunity to work with the nutrition support team, both home, parenteral. They're just starting a new enteral nutrition therapy clinic, and also with the Center for Gut Rehabilitation and Transplant. I also do some inpatient and outpatient work for nutrition therapy support. And I also see some general GI and do some endoscopy as well, which has also been interesting about, good access to endoscopy here. So it's a little bit of everything. But very much nutrition focused, which I've been very excited. I just joined with Dr. Paskey and Dr. Kirby here at the Cleveland Clinic. So it's very exciting. And Dr. Park as well. Yeah.
That's excellent. It really sounds like you're doing the whole practice of GI and nutrition. That's awesome. Very exciting. So tell me a little bit more about the setup that's there. Obviously, they sound like they have a very established digestive disease center. Tell us a little bit more about the setup, the infrastructure that's available to you there.
Yeah. So it's very interesting. I've worked in different institutions before in the past with different kind of support for maintaining a home parental nutrition program. At Cleveland Clinic, they have one of the largest in North America. They have on average, about 300 up to 350 home parental nutrition patients. So you can imagine it takes a very large team to run that. So there have been a large team of nurses as well as dietitians, nutrition clinicians to help manage that. So that's been really good to work on the managers of the home parental nutrition team, as well as the dietitians themselves and the patients. So it's quite a large group. And I think that the fact that they're moving towards enteral nutrition therapy as well, you can imagine it's going to get even bigger in the growth. And what's interesting too, training in Canada, we did do small bowel transplantation, mainly in children and infants. But at Cleveland Clinic, they do quite a lot of adults. It's a huge center for small bowel transplantation and center for gut rehab. So it's very impressive being here and working with everybody. And I've had a chance to meet some of the surgeons and the dietitians that work in the Center for Gut Rehab. So it's a little overwhelming, to be honest, to going to an institution like this, but everyone has been so nice, and transitioning to this role has been very, very exciting.
Yeah, that definitely sounds like a little bit overwhelming. Of course, such huge numbers, but it sounds like definitely like a well-oiled, machine or a good team to take care of these patients. That's awesome. So you mentioned a little bit about transitioning, and obviously you're out of training here at your job. What does that transition look like for you? And if you're just figuring that out, of course, that's perfectly reasonable as well. But what do you think about that?
Yeah, so I'll give a little background story. So I'm from Canada. I was born and raised in Calgary, and I did my internal medicine training in medical school in Edmonton. Mm-hmm. And then I decided to do GI at McMaster in Hamilton. So for people who don't know, that's very close to Toronto. People know where Toronto is. So when I was there, transitioning from working in Alberta, learning the systems in Alberta, and moving to Ontario, where Hamilton is, it was kind of a big jump for me, just personally and professionally, a different system and different ways of working through and managing patients. It's interesting in the field of gastroenterology and nutrition therapy. Of course, we have guidelines to follow, but there's always these little nuances for approaching for different problems in management style. So I've made that big transition through my training, and then to come here and start as a role as a new staff was another larger transition, I think, in a way, to moving to a different country. But I think I've used to adjusting to new roles and adjusting for managements of different diseases and manifestations. And I think it's helpful, and I do encourage young physicians in the field to work at different places and get an idea through electives or working with or getting in touch with different practitioners, because then you really get a good breadth of different approaches and management styles. So I think the transition has been still occurring. I still feel like it might take a year or so to really get my feet planted, but it's been certainly a wild ride. And another advice I give to people is be kind to yourself as well. You're not going to know everything up front. I had to find my office and things like that, even around the hospital. So I think if you give yourself time and be kind to yourself when you're in a new transitional role, that things will work out.
Yeah, great advice, Lindsey. Thank you. Now, Lindsey, I wanted to ask, how long have you been interested in nutrition? Have you always known that this is what you wanted to do? How did that interest come about?
Yeah, great. Thank you for that question. So it's interesting. My undergrad was in cellular molecular microbial biology. So I was actually really interested in gut bacteria for many, many years. And even in internal medicine, I loved the microbiome. I thought I was going to be in infectious diseases. And then I found out that I really liked GI and gastrointestinal diseases. So when I went into GI, thinking about what I wanted to do, I was always branching myself out. I thought about hepatology or even IBD. And then when I really found that nutrition really encompassed all areas of GI, and then also seeing patients outside of GI, like we have cardiac patients or connective tissue disease patients. So it really got that connection that you work with surgeons, you work with different pathologies, and the fact that someone could be so malnourished, but if you provide them that nutritional therapy and really make a difference in outcomes, especially post-surgical outcomes, you can really make a difference to patients' lives. So I really wanted to do something that was more comprehensive and inclusive for different diseases. So it was kind of a windy path, and I certainly deviated into different fields, but I found myself back in nutrition, and I've never been more happy. It's really fascinating to me, metabolism, nutrition, how it changes in diseases. It's just fascinating to me. Like the fact that the microvilli in the small bowel, it's really interesting to me. So I think, yeah, I'm really passionate about it. I think it's kind of fell in my lap, and it does incorporate, microbiome, GI, and really surgery I've always loved as well. So it's a little bit of everything, which I think keeps it interesting as well.
Yeah, I was going to say, it's just so closely linked to the microbiome. I feel like you're exactly where you thought you would be, or maybe you didn't know that, but that's great. I know that you've done the Baxter TPN Parental Nutrition Fellowship. Tell us a little bit more about that. What did that involve? How has that contributed to your career?
Yes, thank you. So this was a kind of a professional development grant that is through Aspen and Baxter. So you can apply for it, and then what will happen is that they can fund you to attend conferences and educational seminars in nutrition. So I think that has really opened the door for me. I'm so appreciative of that opportunity. And it's really interesting. I was in Edmonton, actually, working nutrition with Dr. Leah Gramlich, who's very involved in the Aspen community. And she kind of said in the hallway, you should apply for this. And I was like, oh, it's kind of due soon. I'm not sure. She's like, yeah, go ahead. And so she really sponsored me and helped me with my application and supported my application. And then when I got the grant, it really opened the door. I met some great members of Aspen. I had the opportunity to attend the Aspen conference and really learned a lot, and really kind of forced myself to engage in the Aspen community, which I think was really great, especially as a Canadian grad, to have that opportunity to meet and go to an Aspen conference. And it has really opened up doors. That's where I met Dr. Kirby and Dr. Paskey, and kind of wound myself here. So it's really interesting opportunities that has presented it to myself. So I think I'm so fortunate that I had that opportunity, that Dr. Graham forced me to, not force me, but encouraged me highly to apply, and just for Baxter and the application and the grant to be offered is really, really rewarding.
Wow, that sounds like a really good experience. And you spoke a little bit about, a sponsor and a sponsorship. And that's just so key. I feel like mentorship and sponsorship are just, different things. And we probably need a little bit of both. Can you tell us a little bit more about mentorship and sponsorship in your life?
Yeah. Thank you for that question. I think, and I ask a lot of my interviewees as well when I'm interviewing about mentorship. And I think mentorship is great. It certainly has a role into help guiding you and navigate you throughout your career or even past. I remember I had a great mentor in internal medicine who was a cardiologist and a leading woman in the field. And she was kind of helped navigating my journey into GI, and that was certainly rewarding. But I think sponsorship has a different role in a way that it's really action forward. And I think supporting you for that grant, asking you to speak at the grand rounds, pulling you with you to do a co-presentation. I think it's a little bit more of an active role in a way that giving you opportunities to help set yourself up for success. I think I've had many sponsors over the years that have really opened up doors for me. And I've had also many great mentors as well that have helped encourage me. And I feel that they're both important, but as you say, they both have different roles. And I think as an early career physician, sponsorships are very, very key to get you in the door for those opportunities, and then build your own footing and branch off from there. So I think sponsorship has been really affecting in my life, and mentorship as well.
I completely agree. I feel like sponsorship is just so key and so undervalued. And it's such a key role for young faculty like myself. Well, Lindsey, can you speak a little bit about, current interests? What is clinically interesting, or even from a research perspective, what would you say are your current interests right now in your new job?
Great. Well, as I also said, I just met with one of the research heads at Cleveland Clinic, and, he gave great advice as well. Speaking of mentorship, you have great ideas in your head, and then really putting it down to paper to create a protocol to do research is something entirely different. And I feel like I'm one of those people that have many different interests and passions that I want to follow and always am curious about. But really focusing it onto a research career is another thing entirely. And I think in my journey, I did a lot of work with Dr. Dina Gao in Edmonton with C. difficile management and microbiome work. So that has been very interesting. Also in Hamilton, I worked with Dr. Pinto Sanchez and Dr. Armstrong in celiac disease and indirect calorimetry. So that was also very interesting. I think here it's also, I feel a kid in a candy shop. Like there's a lot of support to do different metabolomics or even microbiome work here at the Cleveland Clinic Institute. So I also have to learn that I have to find those research interests and really consolidate my ideas. I'm definitely interested in metabolism and acute illness. I'm interested in providing nutritional support in critical illness. We use indirect calorimetry, but also other measurements, objective measurements that we can use to help guide our therapy, I think is something very close and dear to my heart at this time. And a lot of QI work, I think, is important in nutrition, especially working in a large group with different dietitians and multidisciplinary. I think the opportunity for quality improvement, I think, is great as well. So, and everyone here is very motivated. So it's very exciting. So that's a long-winded answer of many different areas. I think if you interview me 10 years from now, I'll probably be doing something that I never thought I would be doing. And I think I've been intentionally open-minded throughout my career. And I think that's also another piece of advice, because if you pigeonhole yourself too soon, I feel like you miss all these great opportunities and different paths in life. So I think it's important to keep your kind of eyes open, but also commit to small projects along the way.
Mhm, mhm. That's great advice, Lindsay. And I was wondering if you had any other words of advice for our listeners and young faculty and people who are making that transition, are going to be making that transition soon.
Yes, yeah. So I think, if you're interested in nutrition, definitely getting involved in Aspen has been really important. In addition, this is a plug for the Physician Engagement Committee, but I think that there's lots of great leaders in Aspen who are physicians that can help guide you throughout nutrition therapy. And what I liked about Aspen is that even within physicians, there's gastroenterologists, there's critical care, there's endocrinologists, there's general internists as well. So even within physicians, there's different backgrounds that we can learn to work together. And my best advice, I think, is to do a lot of soul searching and do something that you're passionate about, and find people around you that are also passionate, and kind of ignite that fire. And I think that will lead to a very rewarding career in the long run. So I think that would be my best advice.
Thank you, Lindsay. That was great. I feel like you just spoke a little bit about your passion for nutrition. I can say your passion is clearly evident and honestly infectious. It's been great chatting with you. Thanks for sharing those words of advice and just sharing your experience along your path.
Well, thank you so much. It was such my pleasure. I love these interviews, and it's nice to share my experience, and I hope that helps someone along the way.
Awesome. Thanks, Lindsay. Great chatting with you. It's been an honor to interview you, and thank you, Aspen, for making this possible.
Thank you. Thank you so much.